In the United States right now, we know that we actually eat too much salt. So when we talk from a medical standpoint, we usually don't call it salt, we call it sodium. So when you're going to start looking into other places on the web and you see something, it's going to be called sodium. What is the sodium amount that you actually want? And in most diets, when you have high blood pressure, we would like the sodium intake per day to be less than about 2.4 grams per day. And what does that mean practically? It's about a teaspoon of salt. And if you look at a teaspoon of salt, that's not much, and you're right. So we're going to have to do something for you if you're going to actually restrict your salt that much to help your food taste good. So what are we going to do? Well, practically what you need to do is you need to think about how you're going to get rid of that salt. So the first thing you need to do is throw away that salt shaker. So, well, some people say, well, what about kosher salt? What about sea salt? Salt is salt is salt. If you don't want to eat salt, you have to take away all the salt and throw it away. What is the most common thing people do is they actually go to a salt substitute. A salt substitute is okay. It's a potassium-based salt. But you need to talk to your healthcare professional to see if there's any reason why you shouldn't take that, because some people shouldn't take extra potassium. Other things that you can do is also add herbs. One of the most common things people do is add herbs to their food to give it flavor that would normally be there with salt. The other things to do, very simple things, is try not to eat canned food. Try to eat fresh or frozen. They actually have less salt. And also the other things you can do is if you have to use the canned food, make sure you wash it very well with water. That'll actually decrease salt. So we don't expect you to have a 0% salt in your diet. We just expect you to lower it. And the way to do that is to look at a food label. If you look at a food label, on the back it will clearly tell you per serving. You have to look and see how much a serving is, a half a cup, a third of a cup, and it will tell you how much sodium is actually in there. And then you see how much you eat, and that will tell you how much sodium you've actually consumed.